Nervous tissue makes up the central nervous system and the peripheral nervous system. The central nervous system makes up the brain and the spinal cord, and the peripheral nervous system is made up of all the nerves outside this area. Nervous tissue is made up of neurons. There are two parts to neurons: the cell body, which contains the nucleus, cytoplasm, and other organelles, and the nerve processes that contain axons, which carry messages away from the cell, and dendrites, which carry messages towards the cell. In a nerve process, there is only one axon, but many dendrites. Nerve processes are like arms off the cell body. When many axons and dendrites form together, nerves are created. A synapse is how information gets from one cell to the other. Usually, an axon ends at a synapse and is transported to the next by a dendrite. Myelin sheath encases Schwann cells. Myelin sheath is made up of lipids. Neurolemmal sheath contains most of the cytoplasm. This is where the nuclei is contained and is outside the myelin sheath.
Nervous tissue sends impulses to the body when stimuli are detected. The nervous system is responsible for many things like memory, reasoning, and emotions. What does nervous tissue do? Nervous tissue connects with other tissues like muscle and gland cells. Nerve cells also produce biochemicals that are carried into the rest of the body by axons. Some examples are neurotransmitters. Norepinephrine helps regulate mood and maintain arousal. Serotonin, it has the same effects of norepinephrine. Dopamine acts on emotions and memory and affects emotional responses and stress reactions. GABA suppresses activity. Insufficient GABA can contribute to anxiety. Fibromyalgia is a chronic pain condition that causes widespread pain and tenderness throughout the body. A University of Michigan study published in the Journal of Pain shows that fibromyalgia is associated with central nervous system abnormalities because it is accompanied by elevated sensitivity to auditory and pressure sensations. MS is multiple sclerosis. In multiple sclerosis, the myelin sheaths of the central nervous system deteriorate and are replaced by hardened scar tissue, especially between the ages of 20 and 40. Nerve conduction is disrupted with double vision, blindness, speech defects, and neurosis, tremors, or numbness. Patients with MS experience variable cycles of milder and worse symptoms until they eventually become bedridden. Most die within 7 to 32 years after onset. Rabies is a disease usually contracted from animal bites, involving a viral infection that spreads by somatic motor nerve fibers to the central nervous system. It leads to seizures, coma, and death, and it is invariably fatal if not treated before the central nervous system symptoms appear.
Can you say any more?
To treat rabies, you should clean the wound with soap and water. Then you need to get an injection of rabies immunoglobulin and a series of 5 vaccines over a 28-day period. This will give you protection against the disease until the body produces enough antibodies. Pain medications are used to treat fibromyalgia. Analgesics such as Tylenol, Advil, and Aleve treat pain and are used in addition to other medications. Antidepressants treat the pain as well as the fatigue caused by fibromyalgia. Anti-seizure drugs that treat epilepsy can also reduce the pain.
There are many different types of treatments for MS. One type of treatment is called careful monitoring. This is where the doctors observe and see if the attacks of MS get worse. Another type of treatment to treat MS is medications. Beta interferons is one medication which are prescribed with injections if you have more than one attack a year, which results in relapsing form of MS, or if you don't recover from flare-ups. It is also recommended if there is a buildup of new lesions, even when symptoms do not appear. Glatiramer is another type of medication. It's where doctors prescribe this medication to reduce attacks if you have relapsing remitting MS. This medication is given through daily injections. A third type of medication is natalizumab. This type of medication is a monthly treatment which purpose is to frequently reduce attacks, but is only used if medications do not work. Mixoetrone is a chemotherapeutic drug only used if you have a very aggressive, relapsing and remitting or secondary progressive MS, and is also used if other drugs haven't helped. It has been taken intravenously every 3 months. Medications to treat symptoms. Oral or intravenous corticosteroids. They shorten the time and severity of attacks. Muscle relaxants reduce the stiffness and spasticity. Drugs to treat fatigue. Medications such as amantadine or modafinil reduce fatigue or tiredness. Other drugs which are used are doctor prescribed, including antidepressants, pain and bladder or bowel control problems. Plasma exchange is another type of treatment. This process is where doctors remove blood and they mechanically separate the blood cells in plasma. They then mix the blood cells in the replacement solution, which is normally made of albumin or a synthetic fluid that is similar properties as plasma, and then it goes back into the body. Physical and occupational therapy is also used. Doctors sometimes recommend these therapies to help keep the patient independent. The patient learns to use devices and perform strengthening exercises to help him with everyday normal tasks. Counseling is the last type of treatment. Sometimes a group or individual therapy helps with emotional stress, where it can help both the patient and their family.